Hello, good evening. Dr. Chide Ufondo of Snowspirations Global Health Solutions. Thank you and welcome to Open Clinic with Dr. Chide. And this evening, we're going to talk about the direct, practical ways of achieving pregnancy fast if you're in your 20s. So, if you're currently in your 20s, you have some advantages, but there are certain things you need to be conversant with regarding achieving pregnancy fast. So it's my aim to share those 5 critical important points, ways you can improve your chances, your odds of becoming pregnant if you're currently in the 20s. So in as much as 20s is about the period you have the best time to become pregnant. But if you don't understand the real knowledge, if you don't have a very good attitude, if you don't have a good practices, if you don't have a good perception, you can also struggle to become pregnant in your 20s. So it's important you understand what you need to do, how to improve your chances, specific practical steps you have to take to increase your chances of becoming pregnant faster when you're in your 20s. Now, if you're blessed to meet your partner in your 20s, you actually have a huge advantage because the life of a woman changes as she's getting old. So, if you can start having your kids in your 20s, you will have a lot of advantages because if you want to have 2 kids or 3 kids, and probably you got married at the age of 20 or you saw your partner at the age of 20 and up, you can actually complete your family before age 30. So you can use the whole of that age 30, 40 to gain yourself back, bounce back, recover your confidence. So the best time, if everything favors you to start your family, is in your 20s. However, there are a couple of things you need to do to expedite, to facilitate, and make this work better. So thank you so much, Tosi. Thank you, Love Eka. And I'm also going to give just a few minutes to see if anyone else will join us. If not, we're going to start the clinic. And I want it to be very, very focused because what we're going to do today is very, very direct and practical. Now, if today is the first day attending the clinic, thank you so much. I appreciate you. Please remember to subscribe, remember to comment, remember to like, and then share the channel. Now, there are so many other important, helpful videos which will help you to achieve your objectives of starting your family. So once you come in, subscribe, comment, like, share, then go back and check the previous videos. Immediately after this clinic, I'm going to go to our Facebook page and I'm going to repeat this clinic because we have another audience in Facebook who will benefit from today's topic. So let's start the clinic. You see, the very first thing you have to do as a woman, as a man who desires to start having kids, is to go for what we call preconception checkup. Preconception checkup. So let me give you an idea. If you met your partner and both of you agreed to start your family, so let's assume you're 21 or 22 and your partner is about 20 or 30, it doesn't matter. Find a convenient time for both of you. Go to a good gynecologist for you, and possibly your partner can go to a good urologist. The essence of going for preconception visit is to check yourself up, is to check all your reproductive system, is to check your general system to make sure you don't have any lingering medical problem. So preconception visit is very important. Preconception visit simply means the visit you will go for before you actually start believing God for a baby. So find an official time which will be convenient. It's always good for both of you to go together because there are certain things the man might not understand. There are certain things the woman might not understand, and the doctors will explain it better for you guys. Now, during your preconception visit, your doctor is going to explain your whole reproductive system based on the outcome of your investigations. He's going to give you your chances. We're going to tell you about your eggs. We're going to tell you about about your ovulation. We're going to tell you about your cycle. Now, it's also during this preconception visit that your doctor will encourage you to start taking your prenatal multivitamins, especially focusing on folic acid. So it's important to start early to take your folic acid. Folic acid on itself is not a fertility drug that will improve your chances. But the big advantage of folic acid is to make sure that when you eventually become pregnant, your baby will have a better chance of avoiding developing neural tube disorders. So this is about the time to have those conversations. Now, during this preconception visit, you guys can also talk about the number of kids you want to have, the species of the kids, and some people might even begin to talk about gender selection and all that. So it's a very critical visit you have to embark on. So number one way to improve your chance, because when you know better, you act better. Book appointment for preconception visit. Number two, because at this age 20, you have very high possibility of becoming pregnant because you have a lot of good eggs. Your fertility is stable. Your cycle is stable. You can predict your period to an extent. This is the period to get to know your cycle. Because if you notice you have a regular cycle, you can actually apply your fertility window. So fertility window can actually work for you about this age. So what do I mean by that? Get to know your cycle. Get to know the number of days before you bleed. Get to know the number of days you bleed, the duration, the cycle. Are you 21 days? Are you 28? Are you 35? Do you bleed for 3 days? Do you bleed up to 7 days? So you get to know your cycle. If you can find a pattern, so if you notice you bleed every 28 days and you're bleeding up to 3 days, then you can begin to plot your fertility window around the period of your ovulation. So assuming everything is constant, you know that every 29 days you bleed and it's normal bleeding, and by the grace of God you are ovulating, then the best time to hunker down and plan to start your family is about the fertility window, which is 5 days before you ovulate and a day after your ovulation. So that 7 days window is when you will have a better chance. So younger women can predict their cycle and their fertility can work better. So younger women can actually target making love about a particular time because you have a lot of eggs, you have a lot of good eggs. So your ability to become pregnant every month is very high at age 20 and above before you get to 30. So get to know your cycle. If you know your cycle and your cycle is regular, then you can begin to work with your cycle and you will improve your chance of becoming pregnant faster. Number 3, now I know they've told you so many things. Your mother told you stuff, your grandmother, your friends, your husband, make love in a particular position to become pregnant. No, it's not true. So long as we have contact between the penis and the vagina, even when there is non-penetrative sex, you can become pregnant. So the key word is to avoid all those myths, all those confusion, all those advice, both the one your mother gave you, your mother-in-law, your grandmother, and all that. Forget about that. What you owe yourself is to get to know your partner and make love regularly. In our group, we encourage every other day. So if you can be making love every other day, that's good because you're going to get pregnant faster. That's on assumption that your partner is okay. So if your male partner is okay and you make love regularly, the possibility of getting pregnant within a calendar year is very high. So for couples that are relatively okay and they are making love on the average of every other day and you're in your 20s, within 1 year, you're going to get pregnant. So don't worry about the position. Don't worry about missionary style, going from back, staying in bed after lovemaking and all that. It doesn't matter. Just make love regularly. It works. So let's recount. Go for your preconception visit, get to know your cycle, then regular lovemaking. Very, very important. Now, the 4th factor is a factor that so many women are not obeying. Stress. Stress is not your friend when you're in your 20s. The possibility you might still be in school, the possibility you're looking for a job, the possibility you're inexperienced, the possibility you don't have stability is very high. So the possibility you might be stressing is very high. Now, you do not need direct and indirect stress because direct and indirect stress can affect your hormones. When your hormones are affected, you will not ovulate. When you don't ovulate, you will not become pregnant. The same thing is also applicable to the man. So both of you should work on your stress level. Anything that will make you to stress a lot, anything that will make you not to sleep in the night, anything that will make you sad, anything that will make you guys to quarrel, avoid that, because the more you stress, the more you're affecting your reproductive hormones. And if your reproductive hormones are not balanced, you're not going to ovulate. And if you don't ovulate, you cannot become pregnant. The same thing is applicable to the man. If the man doesn't have good quality sperm because of the lifestyle, because of stress, then he's not going to get you pregnant. So work on your stress level. I know so many people will just tell you, oh, don't worry, relax, and it will happen. They might not be 100% correct. They might not be scientifically correct, but stress can delay your ability to become pregnant, even when you have a better potential of becoming pregnant in your 20s. Now, the last point I'm going to make, you have to modify your lifestyle. There are so many lifestyles that will encourage you to become pregnant. There are other lifestyles that will never encourage you to become pregnant. Number one, you have to eat healthy. Make sure your food is made up of the 5 classes of food. Eat more fruits, eat more vegetables, eat more animal-based protein, drink a lot of water, avoid your soda, limit your consumption of coffee, possibly stop alcohol. Of course, you don't need to smoke. Then you have to exercise. Your body weight can help you to become pregnant faster or can delay your ability to become pregnant. So the possibility that in your 20s, if you're not careful, you might have upper BMI, higher BMI, obesity is very high. So you have to form healthy habits. Exercising is a very good healthy habit because exercise will help you to keep your body weight within manageable level. So eat properly, exercise, sleep. Sleep is amazing. If you're in your 20s and you're not getting enough sleep, you are upsetting your hormones. And when your hormones are upset, you might not be able to achieve that pregnancy as fast as you want it. I know so many people want to quickly start their family within 1 year of getting married, but there are so many factors you need to work on. So these are 5 important steps, 5 important practicable tips you can apply. And before you blink, you are already pregnant. You can actually complete your family before you get to 30 if you're in your early 20s. So live healthy, exercise, eat good food, sleep, drink your water, avoid stress. And please don't worry about the position, just make love and learn about the art of love making. Get to know your cycle, then go for your preconception visit. These are important points I'm going to share with you guys this evening. Now, guys, please start asking your questions. The clinic is going to open now. Feel free to ask your questions. Okay. Love Aka, today is your first day. Thank you so much. We are happy you are attending. I hope you've been impressed. And I also hope you're learning one or few things. And this is your opportunity to start asking questions. I'm sure by the time you go to our video library, you won't even know what to say because you have hundreds of important videos. But I love Eka. Thank you so much for coming. Please feel free to ask your question. Tosi, ask your question. COO, ask your question. So guys, the clinic is open now. Feel free to ask your questions. Now remember this. If you want to have a baby boy, a baby girl, based on the piece of your family, there are ways to achieve this. Please go and register for the Super Masterclass coming up on the 30th of this month. It's a Sunday, 9 p.m. Nigerian time. We have a special panelist which will take you through on the reliable way you can achieve gender selection. There are so many families that are not in pace because the man wants boys and the woman wants girls. You can actually have your boys and girls by the special grace of God. So register for this event. Registration is currently open. But right now, the clinic is open and I'm ready to take care of your questions. Ask your questions, please. If you're joining us, we're just talking about 5 ways you can improve your chances, your odds, your probability, the likelihood of becoming pregnant faster in your 20s. So I've mentioned 5 points. Go for your preconception visit, get to know your cycle, don't worry about the position, avoid stress, then live healthy. It might sound like not that magic pill, but it works. Okay, guys, ask your question. Okay, COO. Are there any benefits of getting pregnant in your 20s compared to older age? Yes, a lot. Matter of fact, the biggest benefit when you start having your baby early, you will avoid a lot of complications in pregnancy. Number one, the risk of having miscarriage and stillbirth, it's very, very minimal when you're younger. the risk of having chromosomal abnormalities like Down syndrome, Edwards syndrome, it's very, very minimal. The risk of developing pregnancy-induced hypertension, gestational diabetes, it's very, very minimal. Your eggs are of good quality. You are younger. You can handle a lot of things at this age. So it's a good advantage, but you have a lot of disadvantages because at 20s, most women might not be fully matured to take care of their babies. They might not be stable. They might not have the money. They might not have good job. So it takes a lot of stability to start a family. But naturally, the right time for a woman to start having her babies is in the 20s. A lot of advantages. Now, your possibility of having infertility is also reduced. So it's when you start getting older that it becomes to be difficult to get pregnant. So a lot of good advantages if you're in your 20s. So I'm encouraging you now. If you're blessed to see your partner in your 20s, start your family early. Don't delay. Now, some people might not be able to see their partners about this time, or they might be pursuing some professional career. Like if you want to be a doctor, you have to go to school a lot of times. So you might actually consider freezing your eggs if you live in countries that have the facilities. So if you don't have your man, if you don't have enough money, if you don't have stable career, you can freeze your eggs in your 20s. Then when you get to your 30s or your 40s, you can use the eggs you froze out your 20s and then your 40s to start your family in your 40s or in your 30s. So that's another option. Can one go into menopause in their 20s? Very, very rare, but it can happen. So any menopause that occurs before 40 is considered premature ovarian failure or premature menopause. So any woman that goes into menopause below 40 is abnormal. Something is wrong. Something happened to your ovaries and your ovaries are no longer sufficient to support pregnancy. Ordinarily, we do not talk about menopause in the 20s. We don't even talk about menopause in the 30s. We begin to have conversation about menopause from 40 and above. So yes, in some women, depending on the microenvironment and the microenvironment and environment, ovarian failure or premature menopause. At 23, you stayed 8 years without kids. You opted for ART, and once you had your twin babies, what are your chances now? You're 34, you're still very young. It's never late to do the right things. Now, my friend Love Eka, I don't know your situation, okay? So it's one thing to marry, it's one thing to be ready to start a family. There is no competition. So if you're not ready to start having your babies and you're in your 20s, yes, you can plan. So you're still 34, you still have 1 year before you get to advance in maternal age. So don't worry about it, okay? The determining factor of having a baby is the status of the woman and the man. Now, if I understand correctly, you stayed for 8 years. You got married at 23, you stayed for 8 years. That means you now started at 31, right? Now you opted for ART. ART stands for Assisted Reproductive Technique. Which one in particular? Did you go for IVF? Did you go for IUI? And at once you had twin babies. So you currently have twin babies, right? And you're 34. You have a good chance. You have a pretty good chance. So what I will tell you is this. You still have a very, very good chance of becoming pregnant naturally. So if you really want to go for another baby, hopefully your twins are not, your twins are at least up to 3 years. Yes, you can go and start trying to have another baby, which you don't like using the word trying. You believe. So you can make love regularly, you can practice, you can pray, then you can see a fertility specialist that can help you. But at 34, I'm not worried. You can easily become pregnant again. Good evening. Tosi, you always have menstrual cramps even when after having kids. Is this normal? So some women will have menstrual cramps during their bleeding as they are normal. Okay. Now, some women somehow there are things that happen in pregnancy that nobody can explain. There are some women that will be having very heavy, painful bleeding prior to having babies. When they have babies, it subsides. Now, on the flip side, there are some women that prior to having babies, they don't have any pain. Then shortly after having babies, they begin to have more painful episodes of their bleeding. So people are wired differently. So it's not unusual to have your regular cramps within the period you're bleeding. It's called dysmenorrhea. Okay, so it can happen to some people. If this is your normal, is your normal. But if it's a new development, then it's possible you might have some gynecological issues going on, fibroid, endometriosis, adenomyosis, polyps. So a couple of conditions in the body of a woman can elicit all these cramps. But naturally, There are some women that will notice that when they have babies, they feel better. And there are some women that will notice that when they have babies, their period feel worse. So some women will notice an increase in the quantity and in the number of days after delivery or reduction. So it depends on your own individual makeup. I love that question. Please keep asking more questions, please. We have at least about 10 minutes, but if we don't exhaust the 10 minutes, it's okay. We can always, keep it for another day. But if you have questions, please ask your questions. If you're currently in this clinic and you're in your 20s, you are blessed. You have a lot of advantages. Make good use of your advantages. Unfortunately, or fortunately, because in life, don't have any regrets. It's only about lessons. Some people might think they can have this at a particular age, at a particular stage, but by the time you get to that stage, life will happen to you. So don't always bank on the fact I want to go get money. I want to find this. I want to find that. Do everything at the same time. It's always important to multitask when you want to start having your babies. The younger you are when you have your babies, the advantage to you and your babies, because you can grow old with your babies. You can have your fond memories with them. You don't want to be getting older. You're complaining up and down with a lot of chronic medical conditions, and you're just about starting your family. Your kids are going to mess you up. That's a fact. Our kids are very, very active. So the earlier you start your family, the better. Okay? All right. Do we have any other question? If you have any other question, please quickly ask before I go. This is very important topic. If you know anybody that will benefit from this topic, share this particular topic with them. Encourage them to show up. So my clinics on YouTube are on Tuesdays, 6:30 p.m. Eastern Time, 11:30 p.m. Nigerian time. Then on Saturdays, 5 p.m. Nigerian time, 12 p.m. Eastern Time US. So when you look for me on Tuesdays, about this time, you will find me here. When you look for me on Saturdays, by 5 p.m. Nigerian time, 12 p.m. Eastern time, you will find me here talking about the topics I love talking about. How do you register? Love Eka, what do you want to register for? First of all, do you live in Nigeria? If you live in Nigeria, you have a good advantage because you can get a consulting package. So number one criteria for getting a personal consulting package is to be resident of Nigeria. That's what will qualify you to get consultation package. But if you don't live in Nigeria, you can still attend our masterclass. Our masterclass is open to everybody. Okay, how about labor? Does age affect it in any way? Yes. Now, if you are young and it's your first pregnancy, your labor is going to be elongated because your body is not trained. So most women that are what we call primigravida, your first pregnancy, during your labor, you're going to have extended labor. Most women in their 20s about to go for, delivery will be hitting about 24 hours, within 24 hours or thereabout, they will have their baby. Now, if you're older, your body is kind of adapted to a couple of changes in your body. So you might have had one or few advantages. So older women will have advantage when it comes to precipitate easy labor compared to younger women. So labor in regards to people that are younger in their 20s might be a little bit laborious, might be a little bit demanding compared to women that are older. So it has to do more with experience. So the older you are, the more you can handle stress regarding labor and all that. Okay, I love that question, Kenneth. All right. Okay, Loveka, you're in Nigeria. Admin is going to set you up. Is bleeding for 8 days during period normal? No. The normal bleeding days is 2 to 7 days. So long as you're bleeding, be mindful. Spotting and bleeding are not the same. So some women can spot for 2 days and bleed for 5 days. Their bleeding duration is not 7 days, it's 5 days. Now, some women can bleed normal, then spot, or some women can spot, then bleed. Always focus on your real bleeding. Your real bleeding is what we use, because if you're going for some investigations, there are some hormones we want to check at a particular time in your cycle. Number 1 day of your cycle is when you bleed first. Now, if you have 37-day cycle, is also not normal. The normal cycle is from 21 to 35 days. So remember this, 2 to 7 days bleeding duration, your cycle 21 to 35 days. Once you begin to go below 1 or above 7, or your cycle is above 35, or your cycle is below 21, then it's considered abnormal. You need to see a gynecologist, and we need to know what to do for you. Okay? All right. Do we still have any other question, please? If you have more questions, please feel free to ask. I'll provide you feedback before I go. Make sure you join me in our Facebook. I'm going to go there live. I will spend about 30 minutes and we'll call it a day. Kate Adane, thank you for coming. Remember to subscribe, set your notifications so you will know when I come live. I come live every Tuesdays, 6:30 p.m. Eastern Time, US, 11:30 p.m. Nigerian time. On Saturdays, I come in a little bit early. I come in at 5 p.m. Nigerian time, 12 p.m. Eastern time, and I spend 30 minutes. Like today, I still have 4 minutes to spend before I go. But if we don't have any other question, I'm going to go. So do we still have any other question? Please quickly indicate. Do you still have any other question? Are we all good? Okay. Thank you so much for coming. Now, I normally devote the last few minutes of my clinics to the babies we're going to have in 2023. So are you believing God for baby in 2023? If you're in this clinic today and you're believing God for baby for 2023, please will you mind sharing the names of your babies? If you're believing God to make you a mother in 2023, this is October. I'm so strongly believing God that by this time 2023 you'll have your baby. So please, will you mind sharing the names of your babies? If you don't want to, have more babies, then that's okay, because you have to know exactly what you can take care of. Don't go competing with other people with the number of babies you're going to have. Find what will work for your family. If 2 kids is going to work for your family, go for 2 kids. If it's 1 kid, go for 1 kid. If it's 12 kids, go for 12 kids. Okay? All right. So I think we've come to the end of the clinic. Okay, so Tosi is planning for 2024-25. That's good spacing. Okay? L dear, that's the name of your baby, Loveka. Okay, good. So God is gonna grant you the name of this baby you prayed for. So by 2023, you're gonna have Ella there. If I got that correct, or maybe you made a mistake, but that's the name of the baby you want to have. God is gonna grant you this particular prayer by this time in 2023. Okay. All right. Okay, guys, I have to go now. Join me in, Kate Adane Chimdire, Osinigwe and Osinachi. Beautiful combo. That's triplets. Be it according to your prayers, according to your promises. God will answer your prayer in 2023. So please, the clinic has ended. Thank you so much for coming. Please join me in Facebook, and I'm going to spend another 30 minutes, and we'll repeat exactly this topic so we have more audience in Facebook. So until I see you, God bless you. And remember my clinic tomorrow. I have a clinic during my lunchtime tomorrow. My lunchtime will be 5 p.m. Nigerian time, 12 p.m. Eastern Time, US. So I normally have a lunch break of 1 hour, and I use it to teach. So I'll see you guys in a few minutes. Then I'll see you guys tomorrow. Until I see you, God bless you and thank you for coming. Bye-bye for now.